Eric, there's also the mental health of the frontline workers. As they see more and more patients, they're also witnessing more and more deaths. Two I spoke with shared some of what they and their teams are experiencing.
Behind the Reverend Chris Kayampa's smile is a stark reality so many of us are dealing with days out from Thanksgiving.
I know the disappointment of not being able to meet with loved ones. I'm far away from my family. I am sometimes unable to be there, and I know that pain.
The mortality rate is real, and a lot of our nurses and physicians are seeing more deaths than they ever have before, and so it's truly emotionally draining.
As of Monday, more than 6,000 COVID-related deaths in Ohio. It's why Dr. Lori Hamama, medical director of well-being with Ohio Health, is taking notice of the mental health of staffers and other associates.
The biggest thing we're hearing right now is exhaustion. So emotional exhaustion, just from kind of having the same conversations, going through that severity of illness again and again and again.
To combat the long hours with no end in sight, Dr. Hamama's team is making room for workers to get fresh air and breaks from wearing personal protective equipment. There's emotional support and encouraging them to talk about their experiences. At OSU Wexner Medical Center, Reverend Kayampa is a chaplain.
We've been initiating phone calls to the patients, phone calls to the families. In many cases, we've been using iPads for FaceTime calls to try to keep that connection going.
Both want you to remember the experiences taking place in their hospitals as you navigate the holiday season.
We're seeing it, we're experiencing it, and we're going to have folks traumatized from the situations they've been in and the care that they've given. So we really need the community to wrap our arms around this and help.
We need to do what we need to do so that we can have holidays in the future, and those chairs won't always be empty.
Dr. Hamama says she encourages colleagues to practice what she calls radical self-care. Get 8 to 9 hours of sleep a night, even if that means leaving the dishes in the sink. Get at least 20 minutes of exercise a day and stay hydrated. And you heard the chaplain there talk about those empty seats. Yeah. That a lot of folks will see on Thanksgiving is tough. This is why we have to practice.
You don't want them to be permanently empty.
Exactly.
And we continue to hear from people who still think this isn't real.
Yeah.
And you want them to talk to these medical professionals who say, this is about as real as it gets.
Which is exactly why we heard from so many tonight.
Yeah,
yeah.
Really important messages from them. And tonight,